Hello, I'm Dr. Farida Modi and I'm a practicing dermatologist and aesthetic dermatologist since the last almost 25 years. This place, Derma Care, I'm the founder and medical director of this since 1999. My special interest, of course, I'm one of the pioneer doctors in injectables, right from your botulinum, fillers and absorbable threads. And I take great pleasure and pride in saying that I've been conducting various workshops across the country since the last more than a decade. Thank you. Hello everyone. So today we'll be demonstrating this new fillers which have hit our Indian market. It's called as Definis, which is by Real Life Minarini, an Italian group of company. So our today's patient, Asmita, she came to us, she wanted to rejuvenate her face. She thought that she's got a small chin, which we all agree. So we're going to quickly assess her face. She's 26-year-old. She wanted to glamorize her face some bit. So when we look at her face, we have to look at her face, but if we have to divide it into three sections, the upper face, the mid face and the lower face. She has a good upper face and mid face. She has a good projection. Maybe at some point we could look into doing a little bit of tear trough, but the need of the hour for her is to work on her lower face. So if we look at her face, she has a small chin, a receding chin. Even if I have to turn her face on the side, if you see, she has a smaller chin compared to the rest of the face. Just by giving a projection here and also helping fill up the mentolabial crease, she will have a more uniform face and will make her already pretty face look more attractive. To balance her face and to project, enhance her lower face, especially her chin, the plan is to use the patented XTR technology Definis filler, which has a palette of different kind of fillers to address all the various concerns of the face. Today we are planning to use Restore. Now their Restore has a good HA of 23 mg per ml. It comes with a high G prime, that is high elasticity, high cross-linking of 3.35%, which is used mainly to volumize, so it can be put on a deeper plane and it can be used for projection and contouring. So today the Restore for her chin. Then along with that, our patient was looking for a little glamorizing of her lip. So we are planning to use the Definis Touch, which again has high hyaluronic acid of 23 mg per ml, but it has good viscosity and low cross-link, which makes it more hydrating, easily moldable, and can be used in sensitive areas like the tear trough, the lip, the perioral line, the periorbital line, if you have any kind of static lines, all of those. The next filler that we are going to be using is something called as Definis Touch. Now this again has a high HA concentration of 23 mg per ml, but it comes with a good viscosity, low cross-linking. It makes the material moldable, well hydrating, and can be used for sensitive areas like the tear trough, the lips, the perioral area, the periorbital area, your static lines. So now let's do our marking. So for the chin, you can either use a needle or a cannula. For me, I prefer using a cannula because that's a blunt tip and we have a lot of important vasculature in this area. The most important vasculature that we have to be careful here is the superior labial artery and the inferior labial artery, which is a branch of your facial artery. So we'll quickly mark those arteries. So you have your facial artery, which from the jawline, from the anterior border of your masseter is coming superiorly, going towards the modulus and branching into your superficial labial artery, and your facial artery at the jawline is at the level of the bone, from where it ascends up, moves to the modulus, and then it moves and branches into two vessels, the superior labial artery and the inferior labial artery, which is again in the deeper plane. So if you're injecting with your needle, you have to be more on the superficial plane here. The next anatomic consideration using fillers in this area would be your mental foramen. So the mental foramen is again in the line of your mid-pupillary line. You drop a vertical line, feel for a depression here, and that's where your foramen is present. And this is of course deep, from where various structures, your vessels and your nerves are originating. So you have to be mindful of this. Okay, the way we will inject our filler, so like we discussed, we are going to be using Restore. The plan is to use 2 ml of Restore, 1 ml on either side, and maybe hydrate a little bit with the touch. We will also use the Definist touch for the lip, not only to hydrate but just to give a mild pout to the client. We will be using a cannula, and with the cannula we will enter in the deeper plane, so supraperiosteal, and then with the fanning we'll also layer up a little on the superficial plane. We will also look at covering the mental crease. So the mental crease again in the superficial plane, so we give further enhancement, projection and elongation to this area. Now if you see, she has a better chin, a better side profile, you know, her double chin is looking much lesser, and she has a better, more hydrated, slightly fuller, beautiful lips. So Asmita, have a look. Are you liking the way your chin and lips are looking? So now if you see, her chin is well balanced with the rest of the face. She has a better projected chin, a elongated chin. Her double chin is looking much lesser, and she has a nice subtle pout, a better hydrated lip, which will get better after a couple of days. Do you like it?
Yes, I like it.
According to the GAIS, which is Global Aesthetic Improvement Score, as a physician, I would score this from a scale of 0 to 4 as 3, which is much improved. How about you? On a scale of 0 to 4, where do you think we have reached?
4.
4. So she feels it's very much improved. And according to the pain factor, where 0 is 0 pain and 4 is very, very painful, how bad was it pain wise? 0. Okay, thank you.